So synovial joints are classified based on the range of motions. If you remember, there are three different planes in the body. One is the sagittal, the other one is the coronal, and the third one is transverse. So based on that, they are classified. There is four different classification based on the range of movement. So the first one is, these are called non-axial, and the non-axial joints are called plane joints. So it means that they are just gliding, or they are sliding on top of each other without any specific axis. Very good examples are the bones here in the wrist and an ankle, so intercarpal and intertarsal joints, and also the joints between the vertebrae. So those facet joints, if you remember it from the chapter 7, those are the ones that are very good as a synovial joint example. So they are flat and they are sliding on top of each other without a specific direction. The second classification is called uniaxial, so they are moving in one specific axis, and these type of joints are divided into a hinge joint and pivot joint. So the hinge joint is one direction only, so flexion and extension. One joint can be convex, the other joint can be concave. And the example one is here is the elbow joint, so between the trochlea of the humerus and trochlear notch of the ulna. Another one is between interphalangeal joints and then the fingers and toes, and the third one can be the knee joint between femur and tibia. The second type of uniaxial is called pivot joints, and there is a rotation. So again, in one axis, but there's a rotation here. And a good example here is the between radio-ulnar joints. So here you can see the head of the radius and radial notch of the ulna. So this is the proximal radio-ulnar joint. This is where you can see these movements. That is this kind of movements that you see is for supination and pronation. Also, you can see the atlantoaxial joint between the C1 and C2 in the vertebrae. Then is another one is called the biaxial movement. So the biaxial movement divides into condylar and saddle joint. So condylar is oval shape. So one on one side you see a depression, on the other side you see a bony prominence, but it's an oval shape. It's not very deep, but they have two different movements. So this is because these are called biaxial. So flexion, extension, abduction, and adduction. An example here, you can see that in the metacarpal phalangeal joint. So these are metacarpal bones, and these are the phalanges. And also you see it in the wrist area and an ankle area. You also see these joints between the wrist bones and between the forearm bones and between ankle bones and leg bones. You can see that. Saddle joint is not that common. You have one concave and one convex, but they are moving in two different directions: abduction, adduction, and flexion and extension. So this is a little bit deeper than this one, and the only area that you see is in the metacarpal joint of the thumb. The last one is multiaxial, so they are going in a different direction. One side is a spherical shape and the other side has a deeper depression. So this is the most mobile joints, and the one that you see is in the shoulder, which is again the most mobile joint in the body, and hip joint, which is also very mobile. But these two joints are at higher risk of dislocation, especially the shoulder joint is much more likely to dislocate than any other joint. So these are the different types of movements of the joint. So when somebody comes with a limitation of the joint movement because of the arthritis, then you can evaluate these patients. Sometimes they may have nerve damage, or they have muscle damage, or maybe the bone fracture. There's also it can limit the movement of the joint. So it can be different reasons. It's not just arthritis. It could be some other reasons as well. So this is the gliding movement that you can see it in the wrist area. Circumduction is, you can see it in the hip joint, and also you can see it in the shoulder joint. It is like drawing a circle in the air. So this is the way that is done, like this. Rotation side to side. So this rotation can be in the neck area, but also it can be in the hip area. So you can see the rotation of the leg, or in the lower extremity, I mean in general. And also you can see the same rotation in the upper extremity. Flexion and extension, and during the flexion, the angle decrease here. The head is coming closer to the chest. So that's flexion, or if it's going backward, that increase extension. You can also see flexion extension in the shoulder joint. So this is moving the upper arm, or upper limb, I should say, anteriorly upward. This is flexion, and if you're moving it backward or posteriorly, that is the extension or hyperextension. You see the same thing in the elbow. So this is the flexion, and moving it backward, it is the extension. Same idea here in the wrist area. So if you move it more, this is the anterior part of the forearm, moving it toward the anterior part of the forearm. This is flexion. And if you are moving the back of the hand toward the back of the or posterior part of the forearm, that is the hyperextension. Same thing happens in the hip area. So this is the angle is decreased. This is the flexion. So moving the lower limb anteriorly, or if you're moving the lower limb more posteriorly, that will be the extension or hyperextension, depending on the degree. And the knee, so if you're moving it forward, that is extension. If you're moving the knee, the leg, the backward, so the knee joint will have a flexion. Moving the lower jaw upward, that is elevation. If you're moving the jaw downward, that is the depression. So this is a jaw-dropping experience, like the first time you saw the amount of information in this class. I'm joking. So there's also protraction and retraction. So moving the jaw forward, that's protraction, and moving the jaw backward, that is retraction. There is, if you're moving your ankle and your foot inward, that is inversion. Moving your foot outward, that is eversion. Moving your foot upward, and this is the dorsum of the foot. So moving it upward, that is dorsiflexion, and this is the plantar surface. And if you're moving it downward, that is the plantar flexion. Also in the you see this in the hands, and in this area in the forearm is not shown here properly. Pronation and supination. So supination is a normal anatomical position. So the face of the hand should be anteriorly, and pronation is that the back of the hand is located anteriorly, the face will be posterior. And our position is like touching the different fingers, the four fingers to the thumb is like making an OK sign. That is a position that you see it mainly in humans. Abduction and adduction. So you have to think of the midline here. So if you are moving toward the midline, that is adduction. If you're moving it further away from the midline, that is adduction with AB. This is AD toward, AB further away. And here is you are thinking of the rest area. So this is if you are moving it toward the body, this is a deduction or adduction. If you're moving it farther away, it's abduction or abduction. In the lower extremity, same idea. You have to think of the midline here. If you're moving it toward the midline, that is adduction. If you're moving it further away, it's abduction. Also the fingers. So for the fingers, a little bit different. So you have to think of the midline here in the hand. So if the fingers are moving further away from the midline, that is abduction. If you're moving toward the midline, that is the adduction. So here is the line, the midline that I'm talking about is in the fingers or in the hand, not in the whole body, toward the whole body, because it will not make much sense. There's also movements in the back area and the vertebrae. So this is the flexion movement, so moving it downward, and this is the extension, moving it backward. There's also side flexion. This is each side, the side flexion, right and left, and also there is a rotation that so this way you can rotate, or you can rotate this way. Because the vertebrae have the mobility to move in a different directions.